Shobana Kamineni joins us now, and it's always a delight and pleasure to have her back on ET Now. Good morning, so nice to have you back on ET Now. Is my voice reaching you?
Yeah, good morning. Good morning, how are you?
All well, all well. I mean, that's a good thing to hear, and that's a good, all well is a good thing to say when we're especially interacting with the management of a hospital, right?
That means we're doing our job well.
I'm actually having a bit of a throat catch today. Maybe I'll call you offline after the show to understand which doctor to consult.
You can call our AI, ask Apollo.
But right now it's not AI, it's between you and me. So I'll take the conversation forward.
Yes.
Let's first understand the big picture. The big picture is that the hospitality or the hospital industry is growing at a double-digit growth. Competition has intensified, government is spending, and PE players are trying to do whatever they can grab in terms of taking benefit of this uptick in the sector. How would you sketch the big picture for us before we get into specifics?
Well, I think the big picture truly is that India is a market that needs any amount of healthcare, and it's only amplified post-COVID that things are coming out and people need treatment. So I do think that if we can get if we can get the right combination of giving great healthcare ahead of them falling sick, so preventive, then the next thing is that if we can have hospital infrastructure which is actually have good doctors in it. Either that's the big shortage. Money is never the shortage. Putting up hospital beds is all infrastructure, which can always be managed. But it's really getting quality and getting trust in people. So I think that in all this, Apollo has scored over the last 40 years, and I don't think that we will waver or move off that path.
Apollo Hospital in last couple of years has diversified. They've just diversified beyond being just a hospital stroke a clinic enterprise. You moved into distribution. You've got a service called Apollo 24/7 where you're giving round the clock service. What is prompting India's most renowned hospital chain to diversify into areas which are not non-core, but these are areas where you don't have a significant presence or a size or a scale?
So just to bring you back, you do know that Apollo had and has 6,500 Apollo pharmacies across the country, and so the supply chain network that we have actually is quite deep and diversified. So this itself is a 10,000 crore plus business, and I think that's important to understand. Apart from the fact that this when Keimed was started, it only 50% of the business was Apollo Hospital. The balance actually served 75,000 other pharmacies today, plus about 2,000 hospitals. So it's a fairly large scale business, and we took a decision last April, if you remember, you all reported it, when Advent invested in this subsidiary of Apollo that did the Omni, that we had this healthcare platform that we built, Apollo 24/7, and also that had the back end. So we said it became a natural for us to bring in this distribution company that was owned somewhat by the promoters, and we said, can we integrate 100% into this company? So this was a decision and informed to the stock exchange in April 2024. We've done quite well and we've accelerated. So Advent's part of Advent's 300 million, which they invested last year, a part of it came in, and the second tranche just came in. So we finished the entire 11.2%, and now we'll move to the 100% acquisition.
Shareholders, I'm talking about the minority shareholder here. There's a promoter stake which the existing hospital has bought, right? I mean, just to get it right. So promoters have, so the stake of 11% which has been bought, that was held by the promoter and that has found its way back into Apollo Hospital, the listed entity. Correct me if I'm wrong.
It's actually found its way into the subsidiary.
Okay.
This is the subsidiary company, Apollo Health Co. It is not in AHEN. So the promoter family has not increased its shareholding in AHEN.
And what would be the value of the distribution business of Apollo Hospital? I mean, if we have to, because, you know, for me, I look at your stock, I say, look, it is sum of part. You cannot value this company purely based on cash flows, P multiple, occupancy rates, because there is diversification which has happened. You're incubating new businesses. There's a pharmacy business, there's a distribution business. What is the value of the distribution subsidiary according to you in terms of rupees crore?
So it's so the value of which is sitting inside Apollo hospitals is different from the Keimed valuation. The Keimed valuation is really a smaller number because of the EBITDA that it generates. But in terms of the other business, the distribution to pharmacy and within Apollo hospitals plus the platform, I think that what we're looking at today is that once we combine everything in the next year or so, we have actually put out projections to them that we should, as a combined entity, it will be 25,000 crores, and it will have a 7% EBITDA, moving towards a 7% EBITDA. It's a possibility because then we've captured every part of the value chain, and that's important. I think that the Apollo shareholders and the Apollo management, we said, let us not leave anything outside. Let's try and put everything together. And of course, it's really, I think it was also a strong governance move.
Okay. I'll go back to a very basic question here. As shareholders, everybody wants companies should make more money, which is occupancy rates. As patients, nobody wants that any hospital should have high occupancy rates. So as a manager, what is the right mix? I mean, what is a good occupancy number which makes shareholders happy and investors happy? Because the more occupancy you have, the more money you will make. Patients would say that less occupancy means that the hospital is doing a great job of patient care.
See,
it's a valid question, ma'am. You'll appreciate the spirit of my question.
Because you have to understand where the demand and supply is. Right now in India, definitely there are pockets and specialities that have low supply. So in those, you will have pressure on beds. And I think that thankfully there's enough out there that in the metro cities, of course, everyone is experiencing.
If you like this video, then like, share and subscribe to ET Now.